Welcome back. In this video, we'll talk about the ECG findings in patients with pericarditis. Pericarditis is defined as the inflammation of the covering of the heart. To put it simply, the heart is covered with a thin layer, and this layer can be inflamed sometimes, and this is known as pericarditis. And this can be reflected in an ECG with some changes that we'll talk about in a second. You will see three distinctive patterns. The first is ST elevation. Unlike the one with myocardial infarction, this one will be concave in pattern. The second one is PR depression, and this is very important because it's unique. Remember, anything that is unique to one condition is very important for exams. And there aren't many conditions that can cause PR depression. And finally, T-wave changes. This can be either by flattening the T-wave or inversion of the T-wave. Depending on the severity of the pericarditis, the ECG might have different patterns. On stage 1, we will see a widespread ST wave concave elevation. In stage 2, we will have resolution of the ST elevation, but the T wave will be flattened. On stage 3, the T wave might be flattened so much and it goes down and will be T wave inversion. And in stage 4, there will be resolution of the T wave inversion, and this is a bad sign. The most notable causes are infections, especially viral infections. Viral pericarditis can be very common. It can also be caused by bacterial or fungal infections. Other causes include lupus or other autoimmune disorders. Patients post-myocardial infarction can also have pericarditis. And this is another very important note for exams. It can be caused by cancer, and it can be caused by uremia, which is elevation of the urea in the blood, which we often see in patients with renal failure. Expect the patient to have some chest symptoms, mainly cough, or chest pain or palpitation, shortness of breath. The patient can have a feeling of sickness or weakness all over, low-grade fever, and sometimes other associated symptoms that are vague and non-specific, like nausea and vomiting, vague abdominal pain, or diarrhea. The treatment is mainly targeted towards reducing the inflammation. So we use aspirin, which is very important and very good in treating early inflammations, ibuprofen, which is a non-steroidal anti-inflammatory drug, and colchicine, which is again a very powerful anti-inflammatory medication. So these are all the important notes about reading an ECG and the ECG findings of patients with pericarditis. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.